Welcome back to my channel. For those who don't know me, my name is Dr. Lado. I am a psychiatrist. Below this video there's a link so you can get to know more about me. Today I'm going to talk about a very interesting topic. Today's topic is something about your thoughts. How powerful are your thoughts? Can thoughts influence the environment? Can thoughts influence brain structure? Can thoughts influence outcome? You know, this is something I'm very interested in because I am a psychiatrist and this is my field, but it's because we exist in thoughts. When we wake up, we have a thought. When we go to sleep, we have a thought. It's very interesting because this is something that we deal with. One of the things that I've learned over the years, that thoughts influence you. And I like to take a step back to some programs that seem to be almost esoteric. The question is, can you change your thoughts to improve your mood, to improve your outcome? You know, one of the things that we utilize is a very big book to refer to a lot of these issues. One of the most important things that we have to think about when we think about thoughts is that if you have a positive thought, do you have a better day? Will you have better health? We do know that thoughts that are at a stress level that's very high can influence the way your brain functions. And particularly, stressful thoughts generate high levels of cortisol. And like I show you in this diagram, you can see how this diagram shows you the interaction between stress and cortisol. This will be a topic later to discuss. Well, let's go a little further. Can thoughts influence the future? Many years ago, there was a good book called The Secret. The Secret was written by an esoteric author who proposed that your thoughts can create your future. The question is this really true? Do we have any evidence? Interesting enough, the book became very famous and it taught you how to be positive, how to create images so you can obtain things. In terms of psychiatry, we do know that if you have positive thinking, it's a type of cognitive therapy. We try to help you generate positive thoughts through restructuring of your ways of thinking to improve your outcome in your daily life and your mood. But the question is, has this been really tested? Years ago, a professor from Stanford, who was a PhD and he's a physicist, wrote a book called Conscious Acts of Creation. He set out to see, do thoughts really impact your environment? It was very, very interesting. What he did, he set out an experiment using 3 types of setups. The first one was he put water in a vacuum where there was no interaction from the environment. He then asked 10 or more religious people to influence the water. Interesting enough, the experiment showed that these people who acted on the water changed the pH by 0.1 unit. Another experiment that he conducted in a vacuum with the same people to think about the outcome of an electrical system. Interesting enough, the electrical system moved. It generated a small amount of voltage. The last experiment had to do with a Drosophila fly. It was a pupa, the pupa where the fly was to grow. And in the other vacuum, nobody did anything over that pupa. Interesting, those people who concentrated on the vacuum with the pupa of the fly grew faster. Is there any belief to this? Is this really true? Another professor named Emoto in Japan did an experiment where he did water. He actually took water and he asked people to influence or have thoughts, different kinds of thoughts like love and hatred. And interesting enough, he saw that there were different images that came up. The one with love had much better crystalline structure than the one with hate. So the question is this, and this is a well-written book, well-known. So how does this apply to psychiatry? It does apply to psychiatry. We're talking about people using thoughts influencing the environment. Of course it's part of me. Now, I referred this to my psychiatry book, and obviously I couldn't find anything. So he proposed, Dr. Tiller proposed with the experiment that there was something that we cannot measure. What does this have to do with psychiatry? I will tell you. The other big question has to do with prayer. Do prayer influence people? Because prayer is a form of thought. You know, a captivating 1999 study published by the National Institute of Health evaluated 990 patients admitted to a coronary care unit and examined the impact of intercessory prayer, defined as a prayer by other individuals in a remote location for a 4-week period. On the ICU course of patients, those randomized to prayer had more favorable ICU course than those without prayer, suggesting that prayer may be effecting supplement to traditional medical care for patients in the ICU. Most reports have shown in 2001 that religious involvement in spirituality associated with better health outcomes, including longevity, greater longevity, coping skills, health-related quality of life, less anxiety, and less depression, and enhanced recovery from illness. Of 212 published studies in 2001, the effects of spiritual factors on healthcare outcomes, 75% showed positive effect, with only 7% impacting negative outcome. In the most recent study, in 2016, the overall concept of spirituality influencing health was studied. In an evaluation of 74,000 individuals observed over 16 years, it's established that women who attended regular religious services had a lower mortality compared to those attended. And one more study I'd like to tell you about. In 2016, a huge study looking at articles across the country of 136,000 patients determined that patients who believe who had a higher purpose in life did better. So the question is, how are these concepts related to our brain? Prayer is a form of thought. So if this is all esoteric, why do these studies show? I cannot say that there is a connection, but there seems to be some kind of connection of the dots. Because somehow what we think and how we feel not only impacts ourselves, but it impacts others. People who are depressed, who have anxiety, cannot have a balanced life. So it is important to be careful what you think and what you feel. So what I'm trying to tell you is that your thoughts do make a difference. Your thoughts do make a difference into the future. The thoughts do make a difference into your emotions. Your thoughts do make a difference into your health. In a future episode, I'm going to show you how exercise can impact your thoughts in a positive way. Now let's go at the brain structure level. They have shown some studies where people have aberrant pathways who do gambling. It's been found that certain parts of the brain can thoughts impact your brain structure. So thoughts not only influence our outside environment, but they seem to also influence our internal networks. We know that stress is a form of very negative thoughts, repetitive anxiety behaviors can cause destructive problems to your cellular network of the brain. It is now known that cortisol levels, which are elevated as a result of stress, can do damage in the areas of the brain that are important for your mood. So you have to be careful what you wish for. You also have to be careful what you think. It is very important to find ways to turn your thoughts in a positive way. There might be some credibility, and I think there's been many research at this point that meditation, things that cause you to release stress, such as exercise, which would be a topic of future discussion. You have to have a certain balance in your life in order to have an outcome that's better. So if everything you hear has been shown to be true, why do we continue to be the same way? Because your mind has been hijacked into believing that you cannot do it. Your mind jack has been to believing that when you're retired at the age of 65, there's nothing else for you. Your brain has been hijacked into believing that you're not capable of doing something. This is a form of negative thinking. But the worst enemy of all, it's not your outside environment telling you this, it's yourself. You see, in order to make a change in your life, in order to improve on yourself, you have to take care of the foundation of what's causing these thoughts. This is why depression is such a very bad disease. And this is why anxiety is such a bad disease. Many people resort to drugs to alleviate the symptoms, which is not the right way to do it. The best way to treat your anxiety is to treat it correctly. We do know that therapy, in the form of cognitive therapy, there's a bunch of therapies that exist out there, supportive, cognitive, they all help you become a better person. So I like to end this interview in telling you that everything is possible, that you can create anything. We are co-creators of what we do. And if you can turn your thoughts around, if you can believe in yourself, then you can make a change. Always remember, you can never love anybody if you don't know how to love yourself. And mental illness has a tendency to self-destruct. I'd like to thank you for tuning in again in this channel. Please give me a feedback. I will give you topics that you like to discuss. The topics I'm coming for you are things that I feel are interesting and also important. But please don't forget to like and subscribe my channel as I continue to look forward to provide you very interesting information. Remember, the more you tell me, the more I give you. Thank you. Until next time.